I'd like to begin our session, my time with you today, short time that I'm having, by acknowledging the traditional owners of this land, elders past, present and emerging. I want to acknowledge each one of you here today, the lived experience that you bring, the knowledge and the lineage that each one of you come from. We really value you and your opinion. So today, the topic that I would like to share or shed some light on and learn with you, because I think that each one of you are experts in this area, is effective communication in consumer partnerships. So a lot of what I'm going to be talking about today and sharing with you are very simple skills and knowledge that I believe that you all already have. However, I think it's always really a great idea to flesh these out and discuss them despite it being obvious and understood, because at times what we think is understood and obvious, there's a lot of assumptions being made, and so when we bring it out in the open, it supports a shared understanding, and it always helps reduce opportunities for misunderstanding when because each one of us is unique and each one of us sees the world from a different perspective, and so bringing obvious things out in the open means that we get to have a shared understanding about this. So next slide, Suzanne. So when I started doing work on this presentation and another one, so today what we're going to do is a snippet of something that's much bigger, which we will be delivering later on, and that's called communicating with influence. So today we're just looking at some strategies, effective strategies. And when I started working on this, one of the first things I did was contact some of our really experienced consumers and talk to them about what are some of their tips and strategies. And so quite a lot of what I've compiled today comes from that. So getting back to basics, consumer partnerships is all about relationships, and it means that we focus on building good and strong relationships. And the result of building strong and genuine partnerships is that it creates connection and it allows for the opportunity for communication and good communication and effective communication. So we feel that it is the lynch point, the point where strong communication can start from. I'm just going to move some things on my screen because I feel like I can't see anybody. No, I'm not going to be able to do that at all. Okay. So the next part is talking about basics of communication, which I have a big slide on, but let's talk about some other things that are linked to your role as a consumer and how it impacts you being able to communicate effectively. So other than having and building strong relationships, the other important things that we want to emphasize on is understanding the context, so knowing about your role within the project or why you have been involved. And these are really important clues about how you would be able to package your communication, and it'll give you tips and clues about who you're speaking to, give you an understanding about your audience, give you an understanding about the context of what you are speaking from. Knowing your why. Knowing your why, we often speak about this, is because doing consumer partnership work can be very tiring, and I think a lot of us have experienced that during this COVID time. And so knowing your why and what inspires you to do this work, and remembering that throughout your journey, is a really important thing, because on days that things are not working well and you've had conversations with people that hasn't worked, it's an important thing to remember to keep you inspired and to continue to persist on wanting to communicate and to get your voice across. Caring for your health and knowing when to walk away. So we're all on a health journey, and your communication is impacted by your health and well-being. So on days that you are not feeling well, reflect and think about how effective your communication will be, and that are there other ways you can do that, and alternative ways you can give your input or at another time. So keeping an eye on that and remembering that is a really important part of communicating effectively. And then knowing when to walk away. This was another really important point that was emphasized by some of our really experienced consumers, that there are going to be times where I suppose you could say agree to disagree, and that you've done your level best, and that means that you walk away from that, but you leave it in such a space that it doesn't burn bridges, and that it leaves the potential for another consumer to step in and continue the work, the good work that you've been doing. Next slide, Suzanne. So these are, again, like I said, basics. So listening. Actually, before I jump into this, the other things I wanted to share was that today we communicate in such a diverse way because of the COVID-19 situation as well. And so we're communicating, like today's focus and our session today is mostly on verbal communication, but I wanted to remind us and reflect on that we're communicating online a lot through video conferencing. And so there are nuances in that as well that we need to reflect and think about, and how it would impact your ability to communicate your point effectively. And then also communicating via email and text and voice. So all of these other things to think and reflect about, and see how some of these things we are discussing today can be applied to that. So listening is a big part of effective communication. I think making sure that we are listening to what is being said, what everybody else is saying, allows each one of us to really bring in the point of views of other people to the table, and then it allows you to come up with what you need to say based on reflecting on what you've been hearing. And it also is such an important part of building strong relationships, which is one of the most important things when you are doing work within consumer partnerships in health. Using reflecting and paraphrasing is another technique that you can use when, and this is a really good technique to use when you are not sure of what has been said, or you want to just absolutely make clear that you've heard what you thought you heard. Using I statements is a really powerful thing to do as well. Last week, Leonie spoke to you about telling your story effectively, and I think that is one of those times where you would be using I statements a lot, because it's reflecting your personal story. However, using I statements when you're speaking about something that sometimes can be seen in a really negative way, it means that when you're posing it from yourself, it helps people drop their defenses down as well. Speaking clearly and concisely and to the point are really important things. Sometimes there's a lot to share and there's a lot of feelings that come up. And so remembering what is that main point that you want to convey and clearly articulating that is really important. And managing all the other things that go around it. Using your confident voice. I saw that Jim was on the call. Oh yeah, I can see him still. He often talks about his teaching background and how voice and using of voice is a really important thing. So think about the voice that you're using. A really important part, I feel, of this work is speaking from your heart. And when you are doing that, people feel that and they feel that connection. So remembering to do that, even though it can be challenging and it puts you in a vulnerable place, and managing that. Last week, when Leonie spoke about how much, with whom, and when, what you say, these are really important things. Allowing others' views, and that's also linked with listening. So you are at a discussion or you have an opportunity to speak, but also allowing other people's point of view to happen is really important. Considering the non-verbals, and this is really interesting when we're thinking about communicating via technology as well. What do our non-verbals mean and what do they convey? And if you are there in person, what are the things that they're conveying as well? So are they really important things to reflect and think about? Just checking my time. Suzanne, do I have 5 minutes still, or?
You've got 2, but we could probably squeeze another couple.
Okay, all right. The last thing I want to say about the previous slide was knowing your audience. So think about who you're communicating to. If we're speaking to your peers, you're communicating quite differently. If you're speaking to a group of clinicians, you're speaking quite differently. If you're speaking to a group of administrative staff in health, you're communicating differently. So think about who your audience is. Next slide. Oh, actually, it was this slide. Know the power players in the room. And watch and observe what they're doing, and tweak your conversation to match that. Asking questions to clarify your understanding. So that was linked to paraphrasing and reflecting and using those techniques. What has not worked? So that's the next slide, Suzanne. Some of the reflections that we got from some of our consumers was, this work is difficult and it can be frustrating. So becoming angry, blaming, being aggressive, using threats, or having a them and us attitude, or burning bridges often creates barriers in you being able to communicate effectively. So being aware when things are not working, and then watching these emotions come up and finding constructive ways of dealing with them and having opportunities to debrief means that you will be able to communicate effectively the actual things that will support change in the health system, rather than these emotions getting in the way of you being able to communicate effectively. Next slide. And then the next one. So I also had a chat to some health organisation staff and asked them about what were some of the things that they thought could support consumers. And here are some of the things that they reflected. A lot of them were around just preparing and your presence during the time that you were at the meeting or with a group of people. So your preparation is really important because it helps you put together your thoughts, and it also brings your confidence up because you have prepared, and you can reflect that and have a mentor or a peer that you work with to support and strengthen those. And then during the meeting, no question is a silly question was a one that I heard from quite a few staff members. So I think it's really important, if you don't understand something, to bring that up and ensure that others are hearing that you're not understanding things, but it allows them to know that maybe they're not communicating in a way that's effective and allowing you to understand what's happening. Sharing your experience, and you could use many techniques to do it. Telling your story was one of them. Other things could be using examples and just speaking from your heart. I think we'll go to the next slide, Suzanne. I wanted to share the Charter of Healthcare Rights. Can I have a bit of I can see one screen of people. Can I have a bit of a show of hands of people who know about the Charter of Healthcare Rights? Yeah, great. For all the people there, I can see Helen now. I wanted to put this up here because I think that it's a really great tool for each one of you to use in terms of giving your feedback. It also is a reminder that you have rights to speak about not only the care you receive, but how that care is, how it's designed, developed, implemented, and evaluated. So a really good structured format, and you can bring this to all your conversations that you have, and it allows you to have a bit of a structure. If you lose your way because things have become overwhelming or things are not going in a positive direction, then you can just pick each one of those items in access, safety, respect, and just ask questions that what does it mean to have access within this project? Have you thought about access for different community groups? What about safety? So you can use each one of those points as a way to structure your conversation. And I feel that not only is this a powerful tool to remind us of our rights within health, but it actually gives us a really powerful structure to use and to navigate giving feedback. So that is the last slide that I have. If there are some links that I have included, which is beyond this slide, and we will send all of these through to you. And what I wanted to say to you about those links and resources is a lot of it is around how clinicians work or health staff work with health consumers. However, I think all of those things can be turned around and you can use them as conversation tools to communicate effectively within health yourself as well. So that's all I had to present today. I hope that you got something out of it and that you all have a lovely week and all the best in all the work that you're doing. And hope to see you next week or the week after, actually. We do this every 2 weeks.